And the congressional briefing that we will release the actual report cards at will be open to the public, not just members of Congress. So stay tuned for more information about the release. It's now my great honor to introduce another dear colleague and also First Lady of New Jersey, Tammy Murphy. I'm excited to introduce right now Stacey Collins, who serves as the Associate Director for Health Systems Transformation at the Association of Maternal Child Health Programs, also known as AMCHIP. She leads the PRISM project at AMCHIP, a 5-year initiative funded by HRSA, who we all met yesterday, the federal agency. The program is designed to strengthen state public health department maternal child health efforts to address the needs of reproductive age women with mental health and substance use disorders. Stacey is also a member of the AMCHIP policy team, educating AMCHIP's organizational members about the evolving health reform landscape, including the Affordable Care Act and Medicaid. In addition to working at AMCHIP, she has worked at the National Association of Social Workers and the National Association of Children's Hospitals. So really incredible connection to our work and a dear colleague. And also next, I am truly honored to introduce Ms. Tammy Murphy. Mrs. Tammy Murphy, the First Lady of New Jersey. We've had the pleasure of working with Tammy Murphy at Mom Congress, a project of 2020 moms, and just really excited to welcome her back and welcome her to this main stage at the Maternal Mental Health Forum. She and New Jersey's governor, her husband, Philip D. Murphy, have been married for almost 30 years and together have 4 children, which hats off to you. It's hard enough to have a couple on my end. 4 is incredible. The First Lady loves traveling the state and meeting New Jerseyans to hear their concerns, utilizing her experience in the private and nonprofit sectors to work through policy ideas and solutions to their problems. Ms. Murphy also previously worked in finance at the United States and in Europe, and has traveled and lived throughout the world from London to Hong Kong. Really impressive. And over the years has worked for nonprofit organizations, a think tank, and other organizations focused on the environment, education, healthcare, youth and family services, and more. As First Lady, Tammy's policy initiatives focus on infant and maternal health, climate change, and education. She's also working on fostering women-owned business throughout New Jersey. First Lady Tammy Murphy, thank you for being a true champion and pioneer in maternal health. And we're so excited to welcome you to the Maternal Mental Health Forum main stage. Back over to each of you.
Thank you, Joy. And I have to echo Joy's gratitude that you're here with us today, Tammy. We have hundreds of other advocates, maternal mental health advocates, who are really thrilled to have you here today and hear what you have to say about this issue. And as we discovered in the green room, Tammy and I have some connections, which we just discovered. We are both UVA, University of Virginia graduates, and our children are University of Virginia graduates, or soon to be so. So we already have an intense connection, in addition to our passion for this issue. So Tammy, I wanted to start out our conversation sort of on a broad scale. And we're hoping you could tell us about how you came to embrace these issues, of all the great issues that a First Lady of a state could embrace. You've taken on one that's near and dear to our hearts, obviously, which is maternal health, maternal mental health. So tell us a little bit about your journey, how you came to where you are now with these issues.
Thank you so much, Stacey, for that. And Joy, thank you for inviting me to join you today. It's a real honor to be here with all of you. So when my husband was first elected, which is now, we're going into our 6th year now, New Jersey was ranked among the top 5 states in the country for maternal mortality rates. And that was very discordant, given that we have one of the best healthcare systems in the country. We are known as the pharmaceutical headquarters for the country. So there were a lot of reasons that didn't make sense. And particularly for Phil and for me, being the parents of 4 children, now young adults, it it seemed extraordinary that we should have these challenges. And we both agreed this would be a great first thing that I could work on. My naivete about, okay, it'll be the first thing I work on. It is going to be something I'm probably going to be working on, I'm guessing now, for the rest of my life, but it is something that I've been passionate about since day one. Just to give you a sense as to where we are, in New Jersey, if you are a Black woman, your chances of dying from maternity-related complications are over 6 times greater than those of a white woman. And if you are a Black child, your chances of dying before your first birthday are 3 times greater than that of a white child. Similarly, if you are Hispanic or Latina, you're 3.5 times more likely than a white mother to die, and your child is 1.5 times more likely to die before his or her first birthday. Given that we're in 2023, that is an absolutely unacceptable place to be. So this is something that we care about, that we have been working on, and we recognize it's required systemic change and a holistic approach to making sure that we can fix this scourge across our country.
Thank you. And sort of zeroing down a little bit more from what you just told us about the statistics in New Jersey, tell us about this great new initiative you have called Nurture New Jersey, where you're looking at a lot of the issues that you just described relative to maternal and child health. We're really interested in hearing about this.
Thank you. So Nurture NJ is something that it's our statewide awareness program that we launched in 2019. It is the goal of that program is to make New Jersey the safest and most equitable state in the country to deliver and raise a baby. It's multi-pronged in terms of, we use it as awareness, we use it for convenings, we use it to help with policy. So there's a lot of different attributes of Nurture NJ. Most importantly, I think, and with respect to what you are looking at today, we spent the first several years not only going around and listening to moms on the ground and hearing stakeholders and understanding what the challenges are, but we also then worked with some experts across the country to develop what we call our strategic plan that we unveiled in January of 2021. The infant and maternal strategic plan is one that has 70 action steps. We have, since January of 21, already completed or at least launched over half of these action steps, and it's really been something that we've followed very carefully because it's been very well considered. And of course, it's a living, breathing document, so we do have the ability to change and pivot as we go along. But so far, it's been something that we've been able to rally a lot of stakeholders around, and that's what Nurture NJ is.
Excellent. And can you tell us about some of your pillars of success? How are you going to measure the success of Nurture NJ?
So it's interesting that you asked this question, because a lot of the statistics that I'm quoting, the maternal deaths and more are lagging indicators. So when my husband first came into office, New Jersey was 45th in the country for maternal mortality rates. We then slipped, despite our best efforts and all of our great work, to 47th in the states. We now are down to 36th. And all along the way, we've had nothing that we can show. There's no benchmark. There's been nothing, because we have to wait for the data to come in. I'm really proud of the fact that the March of Dimes released its annual report card this past November. That annual report card evaluates preterm birth rates, and they do it in 53 states and territories. You might ask why preterm birth rates, and that is a key indicator of the health of mom and baby, of course. So of the 53 states and territories that the March of Dimes examined, 47 went down, 47 in our country. 1 remained the same, and 4 improved. And I don't want to spike the football. I will tell you, New Jersey is one of the 4 where we improved. And so that is really gratifying to me. And it tells me that which we are doing here and now is actually starting to turn the tide.
Thank you. That's great to hear. And I would encourage everyone, if you'd like to ask Tammy a question, please put it in the Q&A, and we will get to those a little bit later in our discussion. So Tammy, you were just talking about racial disparities, and like many states, New Jersey is grappling with this. Lots of other states are as well. And we saw just a couple weeks ago with the CDC, the new CDC data on maternal mortality. These are figures from 2021 that, as you just mentioned a moment ago about some of the other measures that you're looking at, we've gotten worse as a country. We had an exponential increase in 2021 from 2020. So, thinking about your experience in New Jersey, what advice, what recommendations would you have for the country at large as to how we deal with this seemingly intractable problem that we have in front of us right now?
Well, listen, I'm not so full of bravado that I'm going to suggest that I have the answers for our country, but I will say that my husband is currently the chair of the National Governors Association, which is, in my opinion, the most effective bipartisan organization we have in the country at the moment. I say that because it flip-flops back and forth. So last year, Phil was the vice chair under Asa Hutchinson, who's a Republican from Arkansas, a wonderful man. We got along with him very well. This year, Phil is the chair, and his vice chair is Governor Spencer Cox of Utah, who is absolutely spectacular. And again, I would tell you, we have gotten, made great progress with him as well. And the reason why it's so effective is that the governors who are coming together, they want to fix their states. And so they are very open-minded about listening to what's going on and what's working in other states. And it doesn't matter if it's a red state, a blue state, who cares? If somebody has a good idea, then we're all going to listen. So as the chair of the NGA, my husband has the ability to work on an initiative and hold convenings across the United States. And as his spouse, I too get to do this. And so we do a lot together. And so we have twinned agendas, and we have been going out together around the country. We've already held 2 of the convenings, the first one in Salt Lake City and the second one in Los Angeles. His initiative is youth mental health, and my initiative is clearly infant and maternal health. So I would tell you that through the course of the NGA, we have been able to bring shared experiences, lived experiences, subject experts to speak, and all these governors and their teams are there. And so we are able to present a lot of people who otherwise probably wouldn't have access to this level of leadership in our country. And at the end of this, Phil and I are working together with the NGA and an organization called Boldly Go, and we are creating actual roadmaps. So we are going to leave behind a blueprint of, here are all the best practices we've picked up and learned. Here's how we suggest, if you want to tackle this in your state, you can go forward. So I think that come July, I'll be in a really good place to answer that. But I'm loath to tell you that I have all the answers. I love our plan, our strategic plan, and I know that some others have taken elements of it, and that's great by me. But we're hoping we can do even more across the country with both of these initiatives come July.
That's great. And again, sort of following on these lines of the work that you and Governor Murphy are doing at the NGA, we're a very politically polarized country right now. And how do you see the issues of maternal health, mental health, youth mental health being embraced by states of different political persuasions? There's a lot of difference of opinion right now on how we should be approaching social issues generally. So I guess we're looking for your advice on how we push these issues, regardless of what state we live in this country.
Sure. So I think I would say a couple things here. First of all, lean on your government, whether that's local, county, state, or federal. I think that there is a tendency for some people to say that government is overpopulated. It's just this burgeoning, field of people who show up for work at 9 and leave at 5 and they're, not dedicated. I can tell you from personal experience that people who work in government are driven there because they want to help fuel change, and they think that's the fastest way they can do it. There are some of the most professional people I've ever worked with who, if the average American could crack open government and see who these people are and what drives them, they would be really proud of government and want to support it. So my first comment would be, don't look down your nose at people in government on the one hand, but also go to them for help because they need partnership. So that would be probably my first comment. And then the other one is just a general comment, which I'm sure each of you have observed. And that is that there's no one who does not love a mom and a baby. There's no one who wants to see a child suffering. So you put together, youth mental health and infant and maternal health. This is something that we as a country, probably the world, really cares about women and children. And so I view this as a space that is completely nonpartisan. And I can tell you from personal experience as well, having sat in, State of the Union addresses and budget speeches that my husband has given, where I sit in the well, whenever he talks about all that I'm working on, as well as his youth mental health initiatives, you could hear a pin drop. No one is unhappy about that. And then when it comes to, allocating funds, I know New Jersey has really leaned over very hard to do that. Not to mention that Phil signed 43 pieces of legislation in the maternal and infant health landscape alone in the last several years. So there's a lot of goodwill out there.
Excellent. I'm going to pivot a little bit more here and just ask you to speak about the power of community organizations and local communities, and what we have found, certainly in the public health space, as well as the maternal mental health and substance use prevention spaces. It's the community organizations that oftentimes have the answers, and not everybody's listening to them. Yep. Because we are turning more towards government. That's where the funding has to come from. But a lot of the answers reside in communities. So tell us how you are harnessing a lot of that power and wisdom from community advocates, both in New Jersey, and what you're seeing broadly through your work at the NGA.
Okay. So listen, the first year when Phil came into office, I quite literally went on a listening tour around the state. And when I say that, I would meet with anyone who had any skin in the game on infant and maternal health. And that would be obviously first and foremost moms, and hearing what their challenges are, but also whether it was an obstetrician, a doula, a midwife, anyone, any health system, any insurance provider, stakeholder, people who are in policy area. I mean, I was really going around listening to everyone. And the most fascinating piece of all for me, probably one of the biggest takeaways, I think if you ask me here and now, what is the big aha moment, aside from the absolute shock of hearing about the inequities in the space, I would say to you that there are so many good people and organizations on the ground actively working day in and day out to address, in this instance, infant and maternal health, but I think this is just one example. And what I have had the great blessing and ability to do is to use my office to convene people and bring everyone together. Because I think in many instances, some of the community stakeholders have excellent initiatives, but as you just said, Stacey, they might not have the funding, they might not have the platform. So when I can elevate those people in those organizations and we tear down the silos, it's been fascinating to watch as people would say, oh, I had a client last week who could have used a service you're providing, or do you know anyone in your network who might apply to X? And suddenly you find there's an entire network out there. It's really gratifying. And I think that you're absolutely right. The community programs, the community organizations are the ones that have their pulse on the community. And it's also one of the reasons why I think community doulas and a community doula workforce has been such an important component of all that we're doing in New Jersey, because their involvement, their understanding of the cultural issues, of the local stresses and strains and the opportunities, helps them help moms bridge the challenges that they might be facing with a doctor or with someone else if they don't understand or they can't communicate or they're not being able to express themselves. So yes, I think that community organizations are absolutely essential, and I applaud all of those who are on the ground and doing all that they're doing.
Great, that's a terrific message for our audience to hear. I'm going to change gears again a little bit and ask you to speak, tell us your opinion about the issue of the relationship between mental health and substance use disorder. And as probably most people in our audience know, the two major drivers of maternal mortality in the US are suicide and overdose. And there's an awful lot of women in our country and youth who struggle from both. They're duly diagnosed with addiction disorder, substance use disorder, and a mental health disorder. And the numbers in this country are really skyrocketing. In terms of substance use death, overdose, the numbers are well over 100,000. And obviously, COVID has driven a lot of that as well. But what's particularly concerning to our community is how this is affecting maternal mortality, the combination of suicide and overdose. And tell us, if you're focusing on that, how you're focusing on that specifically in New Jersey, and again, with your platform as spouse of the NGA chairman, how you're looking at that, because I know a lot of states are grappling with both of those issues.
Yeah. So, listen, pregnancy is it's a wonderful time, but it's also an incredibly stressful time, even for those in the best of circumstances. And certainly the combination of COVID and heightened access to opioids and substances, it has not helped. As you just pointed out, I really believe strongly the numbers are horrible, but for COVID, they probably would still be horrible, but they're even worse because of COVID. The bad news is they're bad. The good news is they're now getting a little bit more exposure, and people are starting to focus on this and figure and understand that it's a real challenge. Just last November, the New Jersey Department of Health issued a report that said that 58% of pregnancy-associated deaths were due to substance use disorder. And literally that over 80% of them could have been prevented. So when you hear that you can't turn a blind eye to that. That is really shocking that's where we are. I would say to you that, I believe, and I think that Phil believes, that if we are able to have healthy children who grow into healthy teens, who become healthy parents, they will in turn have healthy children. And a big part of what we're doing is we're trying to stop this horrible cycle. And it's a horrible cycle with respect to infant and maternal health. And it's even worse, of course, when you add on the mental health piece and the stresses and strains of, well, I guess you could say COVID now, you could say a war, a possible recession. I mean, there's always something that's going on that's causing everyone undue duress. But our goal is to stop the cycle and make sure that we are giving people the ability to live healthy lives in healthy communities. In New Jersey, we do have a number of initiatives that we are working on. Department of Health is releasing a new grant opportunity that's going to enable us to build out our workforce of community-based mental health providers who can actually address, perinatal mental health and substance abuse. This is essentially, if you think of it, we're just trying to make more people educated in seeing the signs and then being able to know what to do if they do see the signs. So we have done that. We're doing that, and the other one that is kind of my favorite policy of the 43 that my husband has signed is that we followed in Oregon's footsteps, and we are the second state in the country to unveil a universal nurse home visitation program. Ours will be the most robust in the country, and I am beyond excited about it because there is no stigma. Whether you're an affluent lawyer or you are someone who's on WIC, you equally have the opportunity to have a nurse come and visit in your home within 2 weeks of delivery, and not only check on you, but check on mom. They will be trained to look at mental health as part of what they're doing when they go to visit these families. And it's not meant to be invasive. This is meant to literally enable everyone to stay in the comfort of their own home and not have to get on a bus and travel or do whatever it is they have to do to get to a doctor's office. The other thing about that I will just say is that it's really a leveler, because if you think about it, if you're a doctor and you're seeing a patient, you don't know if that patient is wearing their Sunday finest, if they've taken 5 buses, if they, have food on the table, if they have domestic abuse, if they have access to Wi-Fi. There's a million things you don't know if you see someone in a sterile office. And if you go to their home, you will understand a lot better from whence they come. And that will enable us to connect these people with further resources if they need them. And they don't have to use them, but at least we can make them available and make sure they know about what's out there.
And my apologies, I wanted to give kudos to New Jersey early on for that really significant accomplishment with nurse home visiting. It's fabulous. And I hope that you really set a trend and an example for the rest of the country for what you're doing. Tammy, one of your issues within Nurture New Jersey is health equity, which is so important in addressing health disparities within this country. And one of the drivers of the lack of health equity in this country is racism. And how do you see that playing out in some of the outcomes in New Jersey, and again, nationally, by what you're seeing through your role with the NGA?
I think it's awareness, and I honestly can tell you that I myself, when I went into this, I had no idea that we were talking about institutional racism and inequities. I didn't know that. I didn't understand that. I assumed that the inequities and the maternal mortality rates were due to the maternal mortality rates were due to lack of access to prenatal care. It didn't enter onto my radar screen. And I think that that's also another reason that I have been so driven in this space, because I think to myself that, but for the color of my skin, I might not have 4 children, or I might not be here today. And then you say, then people say, oh, it's because people are so, people might be at a disadvantage because of their socioeconomic status. And then I'm very quick to point out, well, I don't think that Serena Williams would be put into that category, nor do I think Beyonce can be put in that category, because both of them nearly died, and both of them have major platforms and an ability to communicate. So this is something that we as a country have to grapple with. And I think that making people aware is very important, and making sure that we elevate that consistently, and not just put it out there, but also offer solutions, which is what we're trying to do. We're trying to show how there are some tweaks that you can, there's small things you can do that will help fix a lot of these challenges that we're facing. And we hope to do it through the NGA as well. I hope so.
Excellent. That's great to hear. I'm going to encourage, I know there's a lot of people listening and watching right now, and please, if you'd like to ask Mrs. Murphy a question, please put it in the chat, and we'd be happy to bring it up as a discussion point. And I know I'm jumping around a little bit in this interview, but I wanted to get back to the issue of our system of care for women with mental health disorders, as well as substance use disorders. And as we know, for a pregnant woman, for example, an OB's office is her first line of, or first point of contact if she's pregnant. And we hope that she gets into care. And one of the issues that we're seeing on both of those points, both mental health and substance use, although screening is so critical, there's a lot of studies now to suggest that it's done inequitably. And in some cases, it's not done at all because, and understandably, OB offices have some reluctance because we simply don't have enough providers. There's such a dearth of mental health providers, especially those that specialize in women's mental health, that it really becomes a sort of untenable situation for a lot of providers. So I guess what I'm asking you is, how do we normalize screening, and how, from a policy perspective, can we think about building up the provider base within the mental health and substance use disorder community?
Well, I think I'll one of those I can definitely answer, and I can tell you that in New Jersey we have tried very hard to make sure that we're elevating those who will be useful and helpful to the process. And when I say that, I'll give you an example. During COVID, when most hospitals, at least in New Jersey, I can't speak for all the hospitals in the country, but many hospitals reduced the number of people who had access. So if you were a pregnant mom and you went to deliver a baby in the hospital, you may have been limited to one person joining you. And even if you've been working with a community doula, for example, your entire pregnancy term, and suddenly you're going to deliver, and then you've got your partner there who has not been, is not well versed on a lot of the terminology, but is the obvious person to be in the room. In New Jersey, community doulas were not considered part of the health team. And so in the middle of COVID, Phil signed an order basically saying community doulas have to be considered to be part of a pregnancy health team. That's a tiny little thing, but when you know that community doulas are able to help reduce the horrible outcomes, that's just a very logical step to take. And there's a lot of things that are like that I would say are kind of low-hanging fruit that we have to figure out as a country. Another example I'll give you is we now make emergency rooms ask when someone shows up. Doesn't matter how they present themselves. They might not be bleeding, or they might, just look normal. Have you delivered a baby in the last 12 months? That's part of the screening intake process. And by simply asking that question, you could save a life. That's so easy. That didn't take a lot. And that's not something that's going to be really a flashpoint in terms of trying to achieve, that small little question on an intake questionnaire. So that's one thing I would say that we're doing. On the other side, we're making reimbursement rates through Medicaid higher for a lot of our practitioners, and that is in an effort to make sure that those who are accepting Medicaid, for example, are not being penalized and having to see twice as many clients as someone who doesn't accept Medicaid. So we're trying to both improve the quality of care and the experience, not only for the patient, but also for the medical provider. And then I guess the other piece on the mental health front, I would say that we require all of our Medicaid providers to complete a perinatal risk assessment form, which essentially is helping to monitor for mental health and other attributes that might need attention. And so they do this upfront and they do this in the back end, and that's to make sure, again, that we are addressing the patient properly and we're providing all the resources necessary. I hope that answers your question.
I appreciate that. And again, I'd encourage our listeners, I see a number of people, lots of people on the call, and if you would like to ask a question, I know we only have a few more minutes with Tammy, but please do. And here's a question that's coming from Joy. How is New Jersey's universal home visiting program being funded? Good question.
We are working on that right now, Joy. It's a joy you asked that question, Joy. So we have some funding that we have put into a good amount of funding that my husband has put into the budget. So that would be one piece of this. And I think that we are hoping that as we roll this out, that we are going to be able to expand the funding sources. But for now, the bulk of it is really coming from my husband in the budget and trying to make sure that we are doing the right thing. But once we have the pilot programs up and we can, prove that this is really successful, I think that we will move forward with Medicaid and other ways.
Excellent. And somebody is asking, what is the model, if you will, for your home visiting program? I think you said nurse family partnership, but someone actually is asking if your program is associated with Family Connects International. I know there's a number of different models for home visiting. Can you tell us which one you're using in New Jersey?
We are actually looking at every model that's out there right now. And we are going to be rolling out. Family Connects is the one that I probably have the most knowledge of at present. And I know that we're trying to, I know that's one that we have been paying very close attention to.
Excellent. And I think I'm going to ask one sort of wrap up question. So your tenure with NGA, I think lasts through this year. Am I correct about that? What advice would you give for the next governor and his or her spouse? And I think actually there already is somebody who's a president-elect. Am I correct?
Yes, Spencer Cox of Utah and his wife Abby are going to be in our shoes next year.
Well, in addition to Governor Hawks, as we go on with other NGA chairs, based on your experience and your platform and your national visibility to these issues, what advice would you have for future NGA chairs and their spouses?
So I think that this goes, I kind of skirted around this question previously, but I think that you're not going to go in and say, this is a horrible example, but it's the only one I can think of. You're not going to go in there and say, let's ban assault rifles in every state in the United States. That's going to be my initiative. That's not going to work. That's not helpful to the conversation. You've got to start in a place that is conciliatory and is something where you give people a chance to participate. So I think you've got to be thoughtful in the topic that you're picking. And as I said, everybody loves moms and babies. And so I feel like the topics that we have chosen as our initiatives are really important. And I think that it enables everyone to take part. When we were in Salt Lake City, a lot of people would say, oh, this is an urban problem. And the fact of the matter is it's not. This is where we just are being inconsistent in our healthcare opportunities for everyone. And being able to highlight different communities in different states, red state or blue state, it doesn't matter. But I'll use the red state example in this one scenario. When we were in Salt Lake City, we actually had the chance to visit at an Indigenous clinic with an entire team of people who were only focusing on the Indigenous people of Utah. Now, the majority of those people live 3 hours outside of Salt Lake City. So having a clinic in Salt Lake City is probably not exactly the best scenario. So the clinicians actually go to the reservation once a week and make sure that they have office hours. But the important part here, I think, is that it's the same challenges that we face in our state that others face in their states. And as long as we can elevate the various different voices and the various different needs and show there's a consistent challenge and they may be, they may look different. The people may look different, or they may act differently or live in different parts of the country. It's generally a lot of the same challenges that we're seeing across the country. And so we can help by elevating all that we're doing in New Jersey and in other states across the country. We can help one another and vice versa. And I would throw out there that one of the best mental health programs that has really caught our eye, and my husband has really been taken by over the course of these convenings, comes out of Utah. So I think that there is a lot to be said for, stepping back and looking and seeing how we can work together and focusing more on all the things that we have in common, as opposed to the things that are dividing us. So that's, I guess, my best advice.
That's great. That's great. Well, I think we've come to time. This has been a fabulous conversation, and we're all I speak for everyone saying that we're all so grateful for you to come here and share your experience and wisdom. And it's really a beautiful wrap up to what has been an excellent conference. So thank you again for sharing your time with us, and good luck with the rest of your tenure as the NGA spouse and shared platform with Governor Murphy, and all the great work that you're doing in New Jersey to really elevate the issue of maternal mental health. Thank you so much.
Thank you so much for having me. And I would say on any and all of these topics, I've already thought of some things I left off on different things. I will make sure our team is forwarding the latest thinking on universal home visitation in terms of how we're paying for that, what the pilot looks like, and more, as well as a few other areas to you, Joy, so that you can share it with all those in your network as well, so we can help others, hopefully, or we'll get feedback from others as to how they can help us.
Wonderful. We will certainly pass it on and make sure we're providing the maternal mental health field support with implementation of these kinds of best practices that you've really been leading on. And I just also wanted to give one more quick shout out. First ladies are doing incredible work, and Mary Jo Cody, a former First Lady of New Jersey, was really instrumental in laying the groundwork in maternal mental health with the first state mandate around screening for postpartum depression, which was just incredible. And the work with your postpartum collaboratives in New Jersey to wrap around services for those who screen positive is really a best practice. Thank you again for your incredible leadership. We can't wait to see what you and Phil do with the NGA and the intersection of these two great important issues of maternal health and children's health. Thank you so much, Tammy Murphy. And we really do feel like we're in your home and we're trusted colleagues, and just thank you for all that you're doing on so many fronts.
Thanks for your partnership, Joy. And Stacy, wahoo wah.